And so to talk with us today about the importance of a dentist in the life of a person with Parkinson's is Dr. Jason Resor. He's a local dentist who does it all and is very experienced in working with people with Parkinson's. You're on.
Okay, great. Thanks everybody. Thanks for the introduction, Nancy, and thanks Patsy for getting me involved. I guess I'll start with just introducing myself. I have a short slide presentation, some things that you guys maybe know a little bit more about already, but this, like Nancy said, will be available as a reference. So, we'll go from there. I guess first of all, I'd like to start with that. I'm not a specialist in Parkinson dentistry. I guess what I try to claim as a specialist in being is being an empathetic dentist. And it's something that we try to do, in our everyday practice. That being said, Patsy's taught me a lot about it, and some of these things are very attainable for us at the office, so that we can make you feel comfortable. And as Nancy mentioned, the importance of it can't be understated. It's something that when it's not a problem, it's not a problem, but when it is, it can be a really big problem. And so, let's do our best to kind of keep up with things. And I think, like you mentioned, Nancy, the preventative part of it is huge. But let me go through a little presentation, and feel free to stop me at any time, ask any questions or raise any concerns, and we'll go from there. Okay, well, there's movie. Okay, so I'll start with a little introduction, a little bit of background. I grew up in Canada, a little small town outside of Toronto. And I didn't start out being a dentist, which sometimes that's a misconception. I have a mouthful of cavities and fillings and an implant down here. And so taking care of teeth is not something I always did. However, I made it through a pretty long career playing hockey and kept all my own teeth. So that was part of my pitch to USC when I tried to get in. Before dental school, I played some hockey in Canada. I had an opportunity to play in college. And then I had an opportunity to move to California to play in the minor leagues. Bakersfield was my first stop, which was a great place that I met my wife. So it was a fortuitous stop for me. And Jennifer and I have been together for 18 years, almost 19 years. And she's a dental hygienist, and she also runs the office. So you'll get a chance to meet her if we come to meet in the future. I mentioned here I played in the Netherlands, which was a great experience, and a few places across the United States. I've valued that time tremendously, both the competition and the hockey and the experiences in that regard, but also just the exposure to different people, and when you meet people from different walks of life, it gives you a little bit of background and helps you understand kind of where they're coming from, which that's something that we hope to bring all the time, but to your situation particularly. Okay, all right. I mentioned my family, or my wife. This is Jennifer, you see in the picture, and my two kids, Zachary and Teslin. We live in Carlsbad, so a little bit outside of Rancho, but we're North County people. Though we moved quite a bit because of the hockey and the school kind of late in our life as a second career. The kids are both into volleyball, and we're doing some snowboarding this weekend. So they're lots of fun at this age. Only a few more years before they're off to college, which is a bit scary. Okay, this is my staff at Town Center Dentistry. We have a pretty big crew. Typically there's two general dentists that are there on the regular, and we have an endodontist that's there, as well as two hygienists. So a number of assistants, and we also bring in other specialists when they're needed. And usually it's once a month for most, but as often as needed. So we have the option to do pretty much everything that happens in the dental world. Okay, so this is something that is, and again, I'm sure most of you are familiar with this, but this is a reference that we wanted to have on the slide, and you can use in the future. It's a way for us to communicate some of the situation, especially on initial visits, which I think this will be helpful. I'm going to make these slides available to my staff as well, because like I mentioned, they're not experts on this, but they will be quickly. And this is something that will be helpful for us, okay? And obviously, these are just some of the highlights, that we talked about. Nancy mentioned a little bit about some of her experiences, the medication that can cause dry mouth, and the dexterity, which I think is a big part of, of that kind of care. I'm a big fan of electric toothbrushes, which I'll show a slide to you. about that in a minute. But this is a big part. It's teenagers that don't really care about their teeth, and then people that care that don't have that have a difficulty brushing them. So, and everybody in between for that matter. So it's something that'll be a big part of our care. Yeah, that's great. And I guess that's some of the electric toothbrush part. Like, you can't really stress enough. Obviously it cleans your teeth better, but even for the amount of time spent, and when cooperation like that is sometimes difficult, then a minimal amount of brushing still does a pretty good job. And so that's something that if you don't have one, everybody needs one of those. And we can, I'd recommend, I guess some people always ask, which one do you recommend? There's two major brands, all right? There's Sonicare, which we'll show you in the slide, and then Oral-B. They're kind of like BMW and Mercedes. Take your pick. They both do the job really well. But if you do buy one, or if you own one, an important part is to always buy the brand name bristles, because the bristles is really where a lot of the research goes into, and so the material and the amount of bristles is important when it comes to the effectiveness. So if you do have one, or if you're getting one, buy the real bristles. These are some of the medications, which again, something just to look for and to expect from them. Some of them affect taste, which is dysphagia and xerostomia, and affected, that's dry mouthness. So the dry mouth, the saliva glands are affected in some cases, and affects your taste. So all of these things are effects of the medication. So those are things that to make yourselves aware of, and obviously the medication list is important when you're being treated. Just some definitions so you guys can look through that at another time. Like I mentioned, some of these things are side effects, okay? And the dry mouthiness is a really common one, and that's something that absolutely contributes to your caries, or to your cavities in your mouth, okay? The saliva in your mouth is an important part of neutralizing acids, and that's something that is always deteriorating throughout life, but especially when it comes to these types of medications. Okay, this is a little bit of an outline of how things can go, okay, or some of the different recommendations. The consultation, which I mentioned before, that to give us a stage and have us prepared for what type of treatment can be done, and going through the treatment plan, being as conservative as possible. I think that's something that in treating an elderly population in particular, we learn that maintaining your own teeth is really paramount in your happiness and in your function. Dentures are difficult for the best of patients, and it's something that we try to avoid, which with participation at home, I think is something that can be maintained in many cases. Yeah. So some of these things, again, you guys can go through this. I want you to be able to ask questions, talking about being aware of what the treatment is, some of the medications that we have to look into, and like the recommendation, one of that stood out to me that I think should be noted is that treatment within an hour or so of your dose, and your morning dose, if you take a medication that helps with tremors. And I think that type of spacing is a really important thing for the success of a treatment. And so I think that's something to be mindful of. And I guess being comfortable, I think, is reading over some of the resources and seeing the different things that I mentioned. As not a specialist in Parkinson's, but paying attention to these things is something that's really important to me as a person. I've moved a lot, and I've had a filling in every tooth in my mouth, so I've experienced a number of dentists. And I think just being open to communicating and having that open line where you feel comfortable with me, I think, is the most important thing, which and hopefully are. If you have any questions, does anybody have any questions about teeth or things that are bothering them? It's kind of a free consultation. So one of those things where if you have a tooth that's hurting, or if you have any questions about the treatment, by all means, ask. I have some, just a couple of things that I say to patients often. It's just about some of the simple things that, not necessarily dental logic, but just, when you have a good side of your mouth to chew on, many people are tolerant and you're happy with that. But when you have a good side, sooner or later, your good side is going to become your bad side, and then you're in trouble. And so those are the kind of things that the early on fixing of stuff really prevents the big problems in the future. And I think that applies to most things, but particularly in dentistry where things can get complicated and expensive. So to kind of avoid both, an early identification of those issues is really important and helpful on both ends, both on the patient and on the doctor's end. One of them is from, something my grandpa used to say was many hands make light work. And I think that applies to teeth as well. Many teeth kind of take some of the stress off the other teeth. And so when you start to lose teeth, you should expect that the ones that are there doing the work are going to deteriorate with kind of like a snowball effect where you start to pick up speed. And so expecting that and being able to kind of prevent that with some treatments along the way is sometimes options. The other quote that I stole from a movie was, when did Noah build the ark? And it's not a biblical question so much as a riddle, but before it rained. And so it's something that you can kind of, that I remind myself of again in many walks of life, not just applying to dentistry, but to take care of some of those things, to take care of things before they're big problems is really beneficial. And even if you are a patient, or if you're a caregiver for a patient that's in early stages, knowing that treatment is tolerated much better at this time, you can have yourself in a more stable position, and enjoy the teeth and enjoy the function of that, throughout your life. Again, my office is in front of a retirement home, and I have a number of patients that come from there. And I appreciate that eating is such a simple thing, and when you can eat, you take it for granted, and just like many things, but keeping your mouth in that state is really important. And obviously it goes beyond that when it comes to being able to chew and help your digestion that way. Those are all beneficial things, getting the proper nutrients that allow your body to do what it needs to do. And yeah, I guess if you get to the office, like I mentioned in some of the slides, please identify and be sure to let the doctors know and the assistants know. And we use neck pillows, I think, like airport pillows, which are sometimes helpful just to give your neck some support. But all that communication and maybe even arrangements can be made for future visits, based on condition and the needs. So. And I think that goes obviously beyond me to any dentist that you go to see, and to be aware of some of the things that we mentioned in the presentation in terms of phases, and in terms of even having your own cheat sheet that you can take to the dentist and say, hey, these are some of the things that are common to Parkinson's patients, because not all dentists are versed in that type of treatment, but it's something that should be accommodated for, or can be accommodated for. If everyone's aware. Okay. This was the toothbrush that I was going to show you guys, and kind of, again, Sonicare makes one that vibrates, and there's another one that rotates by Oral-B. Both are good, and really I don't know too much about the other off-brand names, but the water pick is also a really beneficial thing. It doesn't technically replace flossing, but if flossing becomes something that is too difficult to manage, then this is a great way to keep your teeth clean. Have to warn you, it makes a mess of your bathroom, but it's a great way to keep your teeth clean.
So we covered a lot, and I'm just interested if you have any specific questions, or if you have any experiences that might contribute to what we've discussed. Any thoughts, comments?
I'm the only person here who knows Dr. Reeser, and his office is easy access. There are no steps or anything. It's not, I've been to offices where I stood at the end of the stairs and I thought, oh my God, so there are no steps, it's easy in and easy out, and and there's plenty of parking. So and that's not an issue. So, this is why I brought to your attention, Nancy, because I had been to several offices.
Well, you had called, Patsy had called me numerous times, and she was just beside herself. And I'm, we're always looking for really helpful resources. This is a challenging disorder, now recognized as the most complicated disorder in the world. The medical profession hasn't quite caught up in terms of that. And a good example is Parkinson's should have been listed as a disorder that you'd get the COVID vaccine regardless of your age, but we're getting there. You'll see I'm going to be sending out a notice about sending cards to the government, and this has to do with Michael Oken and Ray Dorsey's book on ending Parkinson's. Part of it is bringing an awareness and bringing everyone up to the 21st century in terms of this disorder and how complex it is, and all the specialists who really, really need to be brought up to date. It's not that they don't want to be, it's not been part of the training in the past. And again, we're working to resolve that. Okay, Cheng had a question. Any comment on anti-COVID toothpaste and mouthwash developed by Colgate and others? Hadn't even heard of it.
Well, I guess, yeah, mouthwash is a beneficial thing, I think, if you can tolerate. One tip I have with mouthwash is that to use something that's from the antiseptic family. Many mouthwashes that are on the shelf are made, and often by companies that you would recognize as making toothpaste, like Colgate or Crest. If you turn on the back of the bottle and you see the active ingredient is often fluoride. If you use fluoridated toothpaste, that is a sufficient amount of fluoride for an adult. So that type of mouthwash has less benefit. So and relevant with COVID, obviously, these antiseptics like something from the Listerine family, those are the ones that you want to go for. And when I say Listerine family, it doesn't have to be the brand name Listerine. Just find the CVS bottle right beside the Listerine, and again, turn at the back of the bottle. You'll see the active ingredients are the same, and save a couple bucks. But something from that is beneficial. And I'm a big fan of mouthwash in general. I think if you can tolerate it, and if expectorating it without swallowing too much is something that you're capable of, then it's a great addition to your oral health care.
Any other questions, comments? Anybody had specific experiences that would be helpful to hear about?
Did you mention anything about a water pick or something?
Yeah, we talked a little bit about the water pick, and I mentioned that, in my, normally I say that it's not a replacement for floss, but if the flossing is, if you're unable to floss, then the water pick's great. Nancy mentioned that sometimes expectorating the water, because there's a lot of water with the water pick, okay? And so going down your throat, there's available tools that provide suction for you, which that can be beneficial. And Nancy, I guess that's something that, that would be great for at home. That's my comment about the water pick. They make a mess, and that water making a mess is the least of your worries if you're swallowing too much. And so the suction is something that we provide, obviously, when you're at the office, but for home care, it's a great tool.
Anything else before we let Dr. Reeser get back to his practice? Comments, any questions?
I just want to thank him because it was
Thank you, Dr. Reeser.
Yeah, of course. And like I said, thanks, Patsy, and for
You're
getting me
very
introduced. Glad we're helping you out, and if we can help anybody else, by all means, get in contact with us, and we'll see what we can do. And if we're not the place, that's okay. Just make sure you're brushing your teeth, and early and often, kind of is the saying. So get out there and get to it, and don't be afraid of it. One of the things, I guess, another takeaway, and something I say to my patients often is it's better to operate from a position of knowledge. So go to your dentist, get some x-rays, make a plan, have an idea of what's going on, and then make some decisions, with you and your family and your dentist as well, but deal from a position of knowledge, so you know what's going on, and it lets you handle it a little bit smoother.
Great. Thank you so
Thank
much
you, Dr.
for
Reeser.
your presentation.